Welcome to Module 2. The previous module introduced you to nanoswarm technology and what the difference is between a nanoparticle and nanorobot. In this module, we will cover the potential applications of nanoswarm technology with a focus on cancer nanomedicine, as well as the characteristics of nanoswarms inspired by swarm behaviour from nature. While the individuals of natural swarms are simple with limited abilities, research has shown that very intelligent and complex group behaviour can emerge. We will discuss how this behaviour emerges in nanoswarms. As we mentioned in Module 1, chemotherapy is systemic, so it targets both the healthy cells and the cancer cells, which can lead to serious side effects. Nanoparticles can assist the delivery of chemotherapy drugs to a tumour. However, clinical translation remains low. In silico models can be used to select nanoparticle design based on things like size, shape, loading, coating. And rather than looking at individual nanoparticles, we can look at how all the particles interact with each other and their environment, so collective nanosystems that work cooperatively rather than individually. Nanorobots are nano-sized entities that can control their motion and interactions with their environments, and nanoswarms are multiple nanoparticles or nanorobots that can interact with each other or their environment to achieve a task exhibiting collective behaviour inspired by swarms. In nature, we see animals like insects, birds, and fish collaborating as a unified system to achieve a common goal. Nanotechnology researchers have now taken this collective intelligence and applied it to nano-sized entities like nanoparticles and nanorobots, discussed in Module 1. Natural swarms are extremely adaptable, scalable, and robust, and can quickly disperse or aggregate in the environment. Natural swarms are decentralized. This means they collaborate and communicate without any central control and react and adapt according to changes in their immediate environment. This enables them to pursue common goals and perform complex tasks. These are some examples of different swarm behaviours that have been used in current robotic applications, and we will discuss these in relation to nanoswarms. Swarms can offer a wide variety of benefits and help us solve some of our most pressing real-world issues in healthcare. Nanoparticles have been in the clinic and clinical trials for over 25 years, and the field of medical nano or microrobots, which include small devices from a millimeter down to a few nanometers, with the aim to safely invade the body and improve health. For example, by sending a swarm to deliver targeted therapies directly to tumours or performing delicate surgery, perhaps in the eye or even in the brain. It's only in the last few years that researchers have made proof of concept advances that could lead to useful devices, such as the BioNot device for rare pediatric brain disorder, and researchers predict we'll see the first clinical applications in 5 to 10 years. The nanoswarm systems that we'll be talking about in this module are largely in research and development. Potential applications of these different systems include drug delivery, imaging, tissue engineering, surgery, gene therapy, diagnosis and detection, and antimicrobial agents. Each of these areas aims to address different challenges in medicine. Micro-nanorobots could use three methods for eradicating a tumour. So they could carry, deliver and release drug in a tumour, similar to current nanocarriers. They can indirectly eradicate a tumour by activating or simulating the immune system against a tumour, similar to immunotherapies, or they can mechanically kill a tumour and induce tumour cell death. As we've seen in the previous slide, nanorobots have different methods for eradicating a tumour, and nanoswarms could do things individual nanorobots cannot do, including spatial organisation, which could lead to higher tolerance to transport and biological barriers, navigation, which could lead to adaptability to complex and dynamic environments such as blood vessels or tumours tissue, and decision making, which could lead to the nanoswarm having information about the state of the tumour, and it could change its behaviour to release a drug. When we look at swarm robotics and nanoswarms, there are similarities when it comes to the coordination of multiple simple agents. However, there are also several differences. The first difference is in size. Nanoswarms are dealing with particles or entities on the nanoscale, whereas in swarm robotics, this is much more on the macro scale. And in swarm robotics, the numbers that you have to make up a swarm can be hundreds or thousands, whereas in nanoswarms, these are millions, billions, or trillions. And when it comes to the power supply in swarm robotics, this could be battery powered, whereas in nanoswarms, this could be powered by enzyme powered methods, acoustic, magnetic, light, or electric methods. Future developments of nanoswarms take inspiration from swarm robotics, and we can imagine how nanoswarms could work in the future in the context of drug delivery and cancer nanomedicine. In these examples, I'll be using a mix of language used in swarm robotics and drug delivery. Let's start with looking at spatial organisation in more detail. First, if we look at aggregation, aggregation allows individuals of the nanoswarm to get spatially close to each other for further interaction. So for example, the nanoswarm can use positive feedback to amplify agents at the target site and negative feedback to repel agents in order to control drug concentration. Pattern formation could allow the nanoswarm to arrange and maintain a desired shape. So for example, the nanoswarm could form patterns and split into subswarms to pass through narrow channels and avoid obstacles. Self-assembly could connect individuals in the nanoswarm physically or chemically in order to establish structures. So for example, nanoswarms could self-assemble into a specific shape at a specific location and is able to potentially repair after damage. Object clustering and assembly would let the nanoswarm assemble spatially distributed objects. So for example, the nanoswarm could manipulate drug and deposit drug at the target site, forming a cluster. The nanoswarm could also prevent agents either physically by physically blocking agents or chemically through communication from depositing drugs at the same time. We'll look at navigation in more detail. Collective transport by the nanoswarm could allow individuals to collectively move objects towards a target. So for example, the nanoswarm could transport and carry higher payloads of drugs which are too heavy or too large for individual agents. Coordinated motion, also known as flocking, could move the nanoswarm in formation. So for example, the nanoswarm could move collectively with minimal or no collisions between individuals and deliver drug cargo. Collective exploration of the environment could allow the individuals to cover an area to search for areas of interest. So, for example, the individuals could use sensing and monitoring of the pH, oxygen, nitric oxide to identify tumour cells within a tissue. Collective localization could allow the individuals in the nanoswarm to find their position and orientation relative to each other. So, for example, the nanoswarm could create a map to the target site and could localize there, or could use stationary tissue or organs with known positions and localize relative to them. Moving on to decision making. Consensus allows all the individuals in the nanoswarm to agree on a single decision amongst all the possible alternatives. So, for example, the nanoswarm could use direct or indirect communication to reach a consensus on which drug to apply given the makeup of the tumour and its different cell types. Synchronization aligns frequency and phase of oscillators of individuals in the nanoswarm so they have a common understanding of time. So, for example, the nanoswarm could achieve synchronized actions or motion at the right time, frequency, and velocity. This could be used to efficiently move through tissue or release a cargo at the same time to amplify its effects. Group size regulation allows the individuals in the nanoswarm to form groups of a desired size. So, for example, the nanoswarm could identify a group size that maximizes performance, such as the ideal size for maximum drug absorption, while decreasing the frequency of drug administrations required for the patient. Collective fault detection within the nanoswarm determines deficiencies of individuals. The nanoswarm system could determine individuals that have deviated from the desired behaviour of the nanoswarm. So, for example, the nanoswarm could increase the stability and resilience of the drug delivery system by maintaining continuous operation, even in the event of a failure of one or more individual agents. So, following on from fault detection, self-healing allows the recovery from faults caused by deficiencies of individuals within the nanoswarm. So the nanoswarm could not only detect faults, but could either repair and aid faulty agents or readjust and ignore faulty agents. The goal would be to minimize the impacts of faults and maximize reliability, robustness, and performance. Lastly, there are other things that need to be considered when using nanoswarms. We need to think about clinical translation in terms of mechanism or mode of action, human nanoswarm patient interaction, and regulation, as policymakers could state nanoswarm treatment must be supervised or directly teleoperated by a clinician. So when we think about human nanoswarm interaction, this would allow humans to control or receive information from the nanoswarm. So, for example, a human operator could track the nanoswarm in real time and could have different levels of control of the nanoswarm system depending on levels of nanoswarm autonomy. Mode or mechanism of action details the nanoswarm journey as a therapy or diagnostic. So, for example, for nanoswarms to be translated into the clinic, a clear pathway of the nanoswarm journey needs to be outlined from absorption, insertion, to elimination, neutralization, or in the case of wearables on the skin, from contact, activation, data collection, and removal. Nanoswarm systems are vast and have many advantages that would be ideal in not only cancer nanomedicine and drug delivery, but other medical applications. I would like to highlight the importance of integrating clinicians, the public, and cancer patients early in the development of these novel technologies. So to summarise, we've discussed natural swarm systems and their behaviours inspired by these systems in swarm robotics. We then focused on nanorobots in cancer treatments and collective cancer nanomedicines. We finished by going through future developments of nanoswarms with a focus on drug delivery and nanoswarm behaviours inspired from swarm robotics. In later modules, we're going to discuss social, legal, and ethical issues that can arise with nanoswarm technology.